The Korean Disease Control Agency says new COVID infections is at 60% of last year's winter peak. Amid a concerning rise in new cases, it is carefully considering when exactly it'll further lower the infectious disease level of COVID-19. The lowering means a complete lifting of the mask mandate even for medical facilities. Shin Se-byuck has more.
The Korea Disease Control and Prevention Agency says the timeline for lowering the infectious disease level of COVID-19 will be handled with more care. According to the head of the KDCA, Jee Young-mee, on Wednesday, the number of new infections is at 60% of last winter's peak. She also mentioned that by mid-August, the daily average of new cases could reach 60,000, with a peak of up to 76,000. In fact, South Korea has seen a rise in new COVID-19 cases for the 5th consecutive week. Last week alone, over 310,000 people tested positive for the virus. That's up nearly 24% compared to the week before. The same official said that a decision on when to lower the disease level will be made after considering various factors, such as COVID-19 trends both at home and abroad, and the advice of experts. The health authority plans to lower the infectious disease level of COVID-19 to Class 4, the lowest level in the 4-tier classification system, as early as this month. With this adjustment, the remaining mask mandate at general hospitals and other high-risk facilities will be lifted. Also, the government will stop monitoring people who have contracted COVID-19. Regarding the complete lifting of the mask mandate, the commissioner stated that specific guidelines will be announced next week after reviewing the risk that the adjustment could pose to high-risk groups. While the KDCA says it is unlikely for COVID-19 to pose a significant threat again, it expects that there could be 1 or 2 surges a year for the time being. It also advises people to wear masks in high-risk places and to quarantine for 5 days if they test positive. Shin Se-byuck, Arirang News.